Good morning, good afternoon, or good evening, and welcome back to Bariatrics and Beyond, the podcast where we talk about life before, during, and beyond bariatric surgery. So grab yourself a drink and a healthy snack, pull up a seat, because today we are talking all about post-op recovery from plastic surgery. And I have a local business in the studio today. We have Natalia from Faja Sweat.
Hi, everybody. Very nice to meet you. Thank you so much for having me. So yes, it's amazing about talking about the post-care.
All right.
I think there are not many people, they know about the post-care after having a plastic surgery.
And it varies from surgeon to surgeon. But let's start from the beginning. Let's get to know you. Tell me all a bit about Natalia, because you have an accent, so you are not from here. So yeah, if you can just introduce yourself and let us know about Natalia.
Yes. I'm from Colombia. My name is Natalia. My last name is Rothermel. I'm from Colombia. So I came to America, believe it or not, 25 years ago.
Wow.
I was pretty young, and I came to Atlanta, Georgia. I went to school in Atlanta, Georgia. Then I moved to Miami. Then I moved to Las Vegas. And since then, I've been here. So, but United States has been amazing for me. It's been a blessing. I had to start obviously from zero, but it's amazing for me, you know.
Yeah.
I'm being blessed. I don't have complaints about this country.
Yeah. Same here. It's like the people
Because
say
you're from Australia,
I'm from
right?
Australia. Yeah. So I've been here for 18 years. So same for you. You know, you start on the bottom.
Yes.
You build yourself up. And you know, I do hear people say America is the land of opportunity, and honestly, it really is. And I've been very lucky.
I'm being blessed, you know, even though that when I came from Colombia, you know, it's zero English. You know, zero.
Oh, wow, really?
Yes.
So you learned English in America?
Oh, it was zero. I didn't even know how to say
wow.
hello. I was so like shocked.
Oh.
Remember somebody said to me, okay, Natalia, one of the most important things that you need in the United States is to speak the language.
Mm-hmm.
So you don't know the language, I mean, it's going to be really hard for you. And then I realized because I speak English, Portuguese, and Spanish, you know what? That opened in the past so many opportunities for me. Even now, even when my employees, if they don't speak English and Spanish, I mean, it's hard for me because my market, you know, my business is about fajas, compression garments. That's what I mean, because everybody Latino is like, faja. What is faja?
Yeah.
That means compression garment.
So what language is Faja? Is that Spanish? Or
Spanish.
It is Spanish?
It's Spanish.
And
yeah.
So Faja means compression garment.
Compression garment. Yeah. And it's
Very
funny
cool.
because you know what? I was trying to figure out what was really the meaning of the faja. It doesn't mean anything. It's just somebody years ago, fajas, they've been around for so many years. Grandmas, they start wearing the fajas after they're having a baby.
That makes sense.
Yes.
So for people who don't know and who aren't Vegas locals or who haven't seen Natalia online, because you do have quite an online personality, so that's how I found you. You own a Faja company out here called Faja Sweat.
Correct.
So tell us about Faja Sweat, and then I want to know the history about Fajas. Where did it all
Faja
start?
Sweat,
Yeah.
Yes, Faja Sweat is my business. So I had a local business. I got my boutique, and I work with plastic surgeons in Las Vegas. Some plastic surgeons, they buy from me wholesale. I manufacture everything in Colombia.
Okay.
People, they say, what's going on with Colombia? Why Colombia? We are very well known because Faja. Even when you go online and you type in Colombian Fajas,
all
you
the
notice
time.
that?
Yes.
So that is the key word, Colombian Fajas, because we had the lycra, and they had the machines. It's very, you know, it's something unique. So they specialize in Colombia with the Fajas, all type of Fajas for surgeries and for the daily use too.
Right.
Okay.
So before you came to America, did you know you wanted to be in the Faja industry?
Nothing.
No?
Absolutely
But
not.
did you know about Fajas in Colombia before you came out?
Everybody in South America, majority, we all know about Fajas.
Okay.
Like I say to you, you know, my grandma, everybody, my moms, everybody, they wear the Fajas.
Gotcha.
Because, you know, they wear Fajas, you know, to hide the little, you know, little extra weight.
Yeah.
And not only that, like I say, you know, when you are pregnant, after the pregnancy, it's amazing because remember, the uterus, they expand a lot. So the only way to bring it back is with the Faja.
Compression.
And years ago, my grandma told me they used to wear like sheets, you know, like bed sheets.
Really?
So they wrap it up just to bring everything back in normal. And that makes sense.
Yeah.
Think about something. Back in the 40s and 50s, we were not talking about liposuction, tummy tuck, mommy makeover. It was nothing.
Nothing.
What was that? Corsets.
Yes.
Remember the women?
The Victorian days.
Yep. The corset,
And
they
then
tied
the
it on
boobs
the
would
back.
be up here.
Yes.
Yep.
And they look amazing.
Yeah. Oh my God. And their waist were this tiny.
Yes.
Yeah.
Exactly. But what make you happen that? Because the consistency.
Yes.
Wearing that all the time.
Yeah.
So
Changes
that's
your
what
body. It morphs
changes
your
your body. Then
shape.
they realize, okay, wait a minute.
Yeah.
If somebody have a plastic surgery, remember what happened after having a plastic surgery? You have a lot of swelling. The inflammation, you have a lot of inflammation. You got a swelling.
Yeah.
So then one of the things they realize, okay, you know what? Fajas.
Yeah.
Compression garment is going to help you to get back in shape. That's why. But I was never into the business.
Right.
When I was living in Colombia, I went to school. I was working for a bank and I studied business. So I was not thinking about anything about fajas.
Yeah.
And when it came to America, I was thinking about I didn't know nothing about this kind of business. So years later, I always been in the manufacturing business.
Okay.
Leggings, hair care products, everything, all the business, manufacturing. I always like wholesale.
Gotcha.
This is amazing because when you do wholesale, I mean, it's better. So, and believe it or not, you know how you start here in Las Vegas?
How?
At the swap meet.
The fantastic swap meet. That's my favorite swap meet. I've been going to that for 18 years. I was just there the other day. Yeah. Actually, these earrings are from the fantastic swap meet.
It's amazing. My father-in-law took me one time there at the swap meet and I say, what is that? And he say, you're going to like this place.
Yes.
And I say, probably yes. When I went to the place, I said, why? I never seen that because we don't have that in Colombia.
Right.
So, and one day I was like, you know what? I'm going to get a business here. I remember I was at the gym and I say to one of my friends and I say, I'm going to get a business. How? At the swap meet. You crazy? Then I went to my ex-husband. I said, hey, listen, I'm going to get a business. Come on, relax again. We got an amazing business. We have a business, hair care products. We were manufacturing keratin treatments, to make the hair straight. Okay, to make it short, I'm like, why now?
Yeah.
So anyway, I went to set it up a booth. I started selling baby clothes.
Oh, so you weren't even setting up a Faja booth. You were just like, whatever. Whatever.
Like what? I just wanted to have a business.
You're such a businesswoman. Yeah, I love
and
that.
And I fell.
Yeah.
It didn't work out. I'm like, oh. Because remember this. They can have baby clothes everywhere.
Yeah, that's true.
Walmart, Target.
That is true. Yeah.
Then I say, you know what? One day I say, you know what? I want to start doing compression leggings. And I was thinking about the compression. I like to work out a lot. I go to the gym every day. So, and I noticed the women, some women, because the women here in America, they have more volume. I mean, they more sizes. Than in Colombia, we are pretty much small.
Yeah.
We are very petite. And then I say, what if we come out with leggings that really make it tight? And the women, they look smaller. Yeah. Perfect. I started doing that. And it was pretty successful, but I didn't have a store.
Okay.
I didn't have the boutique. I only had the swap meet.
Gotcha.
And I was doing the trade shows.
Oh, okay.
I was going to all the trade shows, the bodybuilding shows, and it was amazing. Yeah. But it's like, doing trade shows sometimes you can get tired.
Yeah.
Because it's a lot of work. But it worked out for me for a while. And then I said, you know what? This is too much because then I had my daughter. So anyway, to make it short, one day I got a lady. She came to me and I say, Natalia, you from Colombia? And I say, yes, I'm from Colombia. Oh, that means you had the fajas. And I say, no, I don't have the fajas. I was like, okay, let me tell you this. Kyla, that day, I remember that weekend I paid $265 for the show, right? And I made $45.
Right.
And I get in my car and that was so bad.
Yeah.
Waste time. I keep driving and Lord say to me, Natalia, you see the lady? She was my angel. The lady say, the fajas. And I said, wait a minute, what am I doing?
Right.
I'm from Colombia. I'm already in the manufacturing business. Grab my daughter. Chloe was only a year old. Boom, go to Colombia.
Did you?
And I went to knock the doors with all the manufacturing. Obviously, they say no because to manufacture is high quantities.
Gotcha.
That makes sense.
Yeah.
Then what I did, I went to become a distributor.
Right.
So many companies, they say no. Only 2 companies, they say yes. And I'm still, fast forward, 9 years later, I'm still working with one of the companies.
Oh, I love that.
The other company, they say no to me. And now it's funny because now they sending me emails. They say, Natalia, we want to work with you. I say, no anymore. Because guess what happened now? Now I'm manufacturing. I got my trademark.
You do?
Yes, I have my trademark. And the name of my company is Faja Sweat. And we had the trademark, and I manufactured my own brand.
Your own Fajas.
What I did, so when I started my business, I started with Fajas, general Fajas. So remember, we were selling Fajas for all the people. They just want to enhance the natural curves. For everybody wants to look smaller, right?
Or just smooth underneath the dress.
With the dress, for the dresses, that would be perfect. But one day I say, wait a minute. Yes, that makes sense. But I need to be different than everybody. How I'm going to be different than everybody? Everybody can sell Fajas. But you know what? I want to focus in another niche. And it went right there to the plastic surgeons.
Nice.
And I educate myself. Went back to Colombia. So I went back to Colombia and I started educating myself. Going and educating with the plastic surgeons about the plastic surgeries. Then I went to the manufacturers to find out about the Lycra. What was going on with the Lycra? Why Colombia? Why the Lycra has to be special after the surgery? Because remember this, not many people, they know Fajas, they come by stages. Means by compression. What is that? Means once you leave the surgical place, you have to have a Faja super light compression. Because remember, your body is very sensitive. Remember those days?
Oh, yeah, I do.
Can you imagine if you go right after the surgery with something super tight?
Oh, God, you die. You can't.
That's the right word. You will die. You will be like, oh, my God.
Yes.
And
miserable.
that can cause more inflammation and severe problems because, that can burn the skin, create lines and seromas. That's why you have to be careful. Even fibrosis is scar tissue. So that's why we had to be educated about that.
Okay, so perfect. So can you educate us? Because here at EOC, we are, a bariatric company, but we have so many patients that lose all the weight and they come back to us for plastic surgery. So we have 4 plastic surgeons who specialize in massive weight loss reconstruction. So when they come to us, they're in Mexico, they have their surgery, they are given the stage 1 Faja, and they wear that for however long. But can you explain to us the importance of Fajas during post-op? How important are they and what are the differences?
When they do the skin removal, very important. Very, very important because, even when they do the bariatric surgery, it's great if they have a Faja.
Right.
Because remember, how was your surgery when you had the bariatric surgery?
Yeah, it was...
You have inflammation.
Yeah.
It was painful.
Yeah.
For a couple of days, right? I'm not talking about the skin removal. Just imagine that you don't have the right Faja when they do the skin removal.
Oh, gosh. Yeah.
Exactly. No, so remember, when they do, majority of my clients, they go to bariatric surgeries. They call body lift. They do the 360 tummy tuck. And it's a lot of loose skin. I got this customer. We become friends. She's adorable. Her name is Jennifer. She's from Utah. So she used to be almost 400 pounds. Now she's only 135.
Nice.
But she did the bariatric surgery in Mexico. So then she did another 3 plastic surgeries.
Oh, yeah. Because when you lose that much weight, it's not just a one tummy tuck, get it cut off and done. That's
exactly right. I'm glad that you mentioned that because many people, they think, no, you know what? I'm not happy with my results. Absolutely, you're not going to be happy because guess what? It takes a couple of revisions. It's not the same right away. That the only problem that we have in this technology is they get caught up with the perfect bodies in Instagram. There is no perfect body. No. And when women, they are like plus sizes, 300, 400 pounds, and then they start losing all the weight. Trust me, it takes another surgery. And then later on, they have to do the arms because remember, when they do the skin removal, they cannot do everything at the same time.
Yeah, we can do it as much, like our surgeons, they do as much as they can in one round, but you can never do your arms, your boobs, your tummy, your legs. You have to break it up in several rounds.
And only for that, Kayla, you know why is the recovery?
Oh my gosh, yeah. Surgery time as well and recovery.
So what takes about recovery? Let's talk about recovery because people talk to me, okay, so what do you mean recovery? Everybody can recover. No, it depends. What it depends? The age is not the same when you are 20, 30, 40 and 50. Right?
And the skin quality, especially if you are a massive weight loss patient, the recovery is a lot different to someone who, is just lost a few pounds and, wants the little, tweaks here and there. Our skin is very different. Our hormones different. Our everything is different with a massive weight loss patient, and recovery is a little bit slower.
So that's one of the things. The age. The other thing is not the same recovery for somebody that they removing only, they went from 200 to 150. But somebody that went from 400 to 130.
Different.
The recovery is completely different. So every recovery is completely different. That's why people, they cannot compare with the other people.
Exactly.
Focus in yourself. Focus in your recovery. Because if your mother, but my mom did amazing. I understand.
Yeah.
But you know what? It's not the same.
Nope.
And you know what? Everybody reacts different with the recovery. That's why sometimes they feel so guilty. And I say, I think I regret it. I say, no, you don't. Give it a time to heal.
You know, Natalia, we always see like with plastic surgery, it's such an emotional and mental roller coaster. A lot of people think, oh, I regret this because it is so emotional. And I think it is also because I think your hormones change during plastic surgery. Something changes because you kind of get like that. But I also think it is because people do compare what they see online. Like,
absolutely.
And that can be really damaging.
That is one of the worst things that we can do even with our lives. You know what?
Yes.
I think that I have a nice body. Of course, I have all my surgeries. It's funny because sometimes I got customers say, Natalia, do you have plastic surgery? I say, do you have time?
Yeah, I got time. I want to know, what have you done? I actually don't know all of your surgeries.
Do you have time? Because you know
I know you had your boobs done. I can see them. They look good.
I love plastic surgeries.
Me
you know
too.
what? I love plastic surgeries. And when I see comments from other women say, oh my God, that's just, come on. You know what? Even my ex used to say, oh, also fake. You know what? Just, you don't know what this person is going through.
That's
so you know
true.
what? Don't talk.
Let them
And
have
the
it.
other thing, no, you know what? Most of the people, they get jealous is because those are the ones they don't have the money.
That's true.
And you
That's
know what?
true.
Whatever make you happy. The life is only one. And you know what? Yes, I did my whole body. I got 4 surgeries in my breast because it's not the doctor's fault. It's my fault.
Right.
Because I wish I wouldn't know so many things when I did my surgeries. I didn't take care of myself. What I did, I ran too fast to the gym to work out. And then my implants keep dropping and dropping until last surgery, I did it in Colombia. My doctor, he did it like they call MASH, internal bra.
Yes.
So he did reduction, lift, and the internal bra. So since then, I've been taking care of my bra, my breast because, you know, I don't want to do another surgery because it's honestly, my skin, it gets really weak.
Yeah.
I
Do
don't
you have
elasticity.
your implants over or under the muscle?
Under the muscle.
Okay.
So it's right here.
Yep.
And now I love it. I mean, it's love it. And you know what? One of the most beautiful surgeries I ever done is my breast.
Nice.
I love it.
You feel so feminine, I think, after
It's me.
Yeah.
That's me. Because I'm very feminine. I mean, I like to dress up. I like to wear dresses. I like, honestly, even with my business, when I don't have customers, I like to go to my clothes and I say, what I'm going to wear.
Yeah.
You know why? Because at this point in my life, I do it for myself.
Absolutely.
I've been trying to all my majority of my customers, they are 40, 50, and 60.
Yeah.
At this age, do you think I'm doing this for other people? No, not anymore. For me.
Yeah.
Because I learned something. You know something that I learned in 2025?
What'd you learn?
Is me. Yes. The only person is going to save me is Natalia.
Absolutely.
The only person is going to love me is Natalia. The only person is going to be with me no matter what is Natalia.
Yep.
So you know what, Natalia? I'm going to love you. Natalia, I'm going to take care of you. And you know what? If it is going to take money and to do something for me, I'm going to do it now.
Yeah.
Because most of the years that I've been living is saving other people's life.
Yeah, I feel you on that one. Me too.
What about Natalia?
It's your turn now.
Exactly. It's my turn. So, and that's what I say to my customers. Because believe it or not, people can agree or disagree with me. You know, when sometimes, not every time, when you are plus size and you got extra weight, you got little self-esteem issues. Or even when you are super skinny.
Right. I feel like just us as women, there's so much weight that we carry with body image.
Yes.
And I can tell you, Natalia, I have been every size there is. No matter what size you are, someone's always going to have something to say.
Yes.
You're never going to please everybody.
Never.
So you have to please yourself.
Exactly. That's what I do. So you know what? You know what? I see those ladies, you know, I got a phone call today that was funny. She said to me, Natalia, I need to see you ASAP. I say, again? And I say, yes, because I'm doing another surgery. I got divorced and I need to look amazing.
People are doing like the mummy makeovers and then they're doing like the divorce makeovers.
You know
the
why?
Revenge body.
You know why?
Yeah.
Because when you're going through separation, your self-esteem goes down.
Oh, yeah.
It depends on the situation.
Yeah.
But when you go through separation, your self-esteem goes down. Like, wait a minute, what happened? What did I do wrong?
Right.
So then what do? You start going to the gym.
Yeah, you change your hair color, you get a tattoo, you go have surgery.
You change your hair.
You change
You
your
go to the hair salon. I say, do something amazing for me. I want to look amazing. I want to look beautiful.
Yeah.
So then is when the plastic surgeries, they come in place.
That's true.
That's when I say, you know what? I'm going to do the plastic surgery. But one of the things I always say to you, be smart with the plastic surgeries. Why I say be smart? First of all, if you decide to do a plastic surgery, the most important, do a research.
Yes.
Just don't go and run to do it with the cheapest one. This doctor is so cheap and this doctor is so popular. Or this doctor is good for my friend. No.
Yeah. Or this doctor can get me in next week.
No. I always say to all my customers, I say, listen, at least try to do at least 4 to 5 different consultations. Yep. And they say to me, Natalia, that costs money. I say, I'd rather to pay a consultation. Yeah, exactly. Yes. Than I not go to a doctor and he ruin my body. Remember, once they ruin your body,
it's
hard to get it back.
Yep.
Because then you have to find another reconstruction, you know.
It's so much more expensive. Yep.
It's more expensive. And then you're going to deal with the trauma. Yep. Because then you are so scared to, to look at yourself in the mirror. So that's why I say, you know what, do the research. Take your time.
Yeah.
Because I know there's so many women, they get so desperate and they go and do a surgery.
Yeah, no, you're right.
And the other thing, there is nothing wrong going to Tijuana, going to Guadalajara, going to Colombia, going to Turkey. There is nothing wrong with that. You know what is wrong?
Some of the best surgeons are there.
Oh, amazing. I've seen amazing results when you go overseas. This is the thing.
Yeah.
Just stay at least 2 weeks. Yep. Or 3 weeks. Because this is the problem. I got this woman that she only stayed for 10 days. She came back. On the way back, the stitches, they open up.
Okay.
And then she got an infection.
Oof.
And then it's so hard to find a doctor to take care of that. Because if you go to a top doctor here in Vegas, trying to fix a mistake, they're going to say, no, you know what, Natalia, just go somewhere. They don't want to touch them. Exactly. Yeah. So that's one of the things. Nothing wrong. Just go. Do a stay at least 2 weeks, 2 to 3 weeks. Make sure everything is healed. Make sure that you are fine. Fly back. That's it. And the other thing that I noticed with the plastic surgeries, what is one of the worst mistakes? People don't save the money for the post-care. They think the surgery is only going to the plastic surgeon, do that. No.
That's it. No.
So what about for the post-care? What is the post-care? You have to save money for the fajas, for the lymphatic massages, for the extra things that you're going to need.
Little extra medications.
The abdominal board, lipophone, all those things. But not only that, remember, you're not going to be producing money for at least 3 to 4 weeks.
That's true too. That's true. So, and I think, a lot of people just take into consideration the cost of the surgery, but to have like that really successful result, 50% is the surgeon, 50% is your aftercare.
Yes.
So it's very important to, I think, prepare yourself before surgery all about the aftercare rather than have the surgery and then just wing it through the aftercare. So it is very important to have someone like you on board and to have your massage therapist, find your massage therapist before you go for surgery. Have your massages scheduled, budgeted for, because you need about 10 to 12, 15 massages after surgery too.
Yes, absolutely. Yes.
So,
and that's a problem. You know what? I think that unfortunately here in the United States, there is a lot of lack of the information in regards to the post-care. The doctor, they just do an amazing
They do their job because it's their job.
Exactly. They do an amazing job with the surgery. But what about the post-care? Why they don't say, hey, listen, one of the things that you have to be careful is make sure that you have the massages. Make sure that you write the word faja because they can ruin a faja. They can ruin the body with a faja, with the wrong faja.
Yes.
So then people, what do? They go online and buy something super inexpensive.
Yeah. Because no one wants to pay like, oh, wow, I've just spent this money, but then they go like, oh, $50 for a faja or $150. I'm just going to buy the $50 one, but they don't realize that could be the make or break of your results.
I just received a messages from Michaela, and she did a post, and she said, I can't believe it. I went to Amazon and buy at least 16 to 18 fajas, and I send it back all of them, and nothing worked for me. So by the time that you send it back, by the time you figure it out, it's going to be weeks.
Yeah.
So then your surgery is going to be.
Yeah.
So you have to go back again and do it again. You don't want to, remember all of this, it takes time for the recovery.
It does. And do your research before you do your surgery. Do your research on recovery before surgery. That's what I love about your shop. So can you tell us a little bit about Faja Sweat? Because
Yes.
You don't do walk-ins, you're appointment only.
Yes.
But if you're not local to Vegas, you also help girls all over America. And I think I've seen you send stuff to Australia too. Like I know there's an Aussie girl that I see. So tell me about like how you operate your post-op.
So the way that we deal with my brand, so I focus like I say about post-care.
Mm-hmm.
We had 3 different Fajas.
Mm-hmm.
We have many Fajas, but the only thing that I care is the stage 1, stage 2, and stage 3. That's it.
Mm-hmm.
So they call me. So I do exactly like the same thing. I need to see you. I need to do FaceTime. We design our Fajas by weight, not by dimension.
So you FaceTime all your online customers?
Or FaceTime.
That's great.
So they make an appointment.
Mm-hmm.
Mayra, remember Mayra, my assistant, she does all the booking.
Okay.
So Mayra does all the booking. And then I say, you know what, Natalia is available. It takes me about 5 to 10 minutes. What do I need to know from you?
Yeah.
Okay, first of all, I will ask you, okay, most of the times, sometimes I don't. I ask your age, because that helps me a lot for the recovery. How much do you weigh? I need to know exactly how much you weigh. People say, I don't know. Say, just tell me before the surgery.
Before surgery.
Because believe it or not, once you leave the surgical place, your weight is the same.
Yeah, or more. Because you're so inflamed.
Because all the fluid, all the inflammation. That makes sense?
Yes.
And then I say, okay, I need that you show me, the person is wearing a bra and panties.
Mm-hmm.
Okay, they don't need to be completely naked.
Right, but you
just
need to see their body.
Yeah, just to see the body. So
and this is before surgery you do this?
Sometimes I do before and sometimes after. It doesn't matter.
Okay.
I would love to do it before because it's easier for me, the transition, once we go to the next stages.
Yep.
But I know if I had to do it like that,
if they've already had their surgery,
I will do it. We will catch up.
Yeah.
But sometimes it's harder for me when you call me 6 months later.
Yeah.
And even had customers, they call me a year later. And it's not the same when you call me 1 week later, 2 weeks, than 6 months.
Mm-hmm.
Why? Because in the beginning, remember, we're working on the inflammation.
Yes.
Okay. So then I ask you a question. What is the heaviest weight you ever been? Because that will tell me how is your inner thighs, how is the skin.
Yeah.
So because I had to see you, and I had to see your body and your legs. Why? Because that will determine if the faja is going to be short or long.
Yes.
That is the thing. So then I say, okay, and I will give you a recommendation. And also, you know what? If you're going to do the surgery, be specific. What kind of surgery?
Mm-hmm.
Because you say, Natalia, I'm going to do the tining right there in your special area, in the private area. I had to be careful with the opening right there in that area.
Yes.
Things like that. And the customer say, Natalia, I'm going to do the inner thighs too. So, Natalia, I'm doing a BBL. That's what.
You want to preserve the BBL. So is it true you don't want too much compression on?
Absolutely not, because the BBL is very tricky.
Yes.
The first week of the BBL is when you have to be careful, because it's when you can kill. Yes, you will kill the fat. So that's why you have to be careful. That's why the compression, even for the BBL, it comes by stages.
Yes.
So they are like, what about here? I say, no, okay. Once you have a BBL, the main focus is this area. Then we will focus in this area. Because no matter what, this area, we're going to start working on that later on.
Yeah.
But at the BBL, the 2 first weeks, oh my God, it's
very crucial.
Like so careful.
Yeah.
Very careful. So anyway, that's what I do with my customers. And I say, okay, this is the option for you. This one will be the right faja, but why I want to see you? Because I want to explain it to you exactly, all the process.
I love that you're educating people as well. I love that.
You know what? Yeah. Today I got a lady, she was very sweet. She said to me, she was crying. I said, I don't know where to start. I'm so frustrated.
Aww.
And I already have my surgery. She was in pain. She was wearing a binder, and the binder, what happened with the binder? Binder, it becomes really uncomfortable. Why the binder? Because binder is like a strap.
Mm-hmm.
And every time that you sit down, it goes right here. It bunches. Not only that, it digs right there on the skin.
On your incisions.
And it moves around. Yeah. So that's why binder is not the best option. It's good for about 3-5 days. That. Why doctors, they use the binder? That makes sense, because it's easier to put it on when they are in the surgical place.
Mm-hmm.
But at 3 days later, they need to recommend the faja, but they don't do it. I see customers wearing a binder for weeks.
Oof.
No, my doctor says 6 weeks. And I say, what happened with the binder? Let's talk about a little bit about the binder. Okay. Like I say to you, binder is an elastic strap, right? So what it does, it gets a great compression right here in this area, but not right here. And remember, when they do the what is mommy makeover? So remember, every time that we have babies, the skin, it gets loose. So the doctor, it goes right here. Sometimes they do the mini tummy tuck. It depends on the body.
Yeah.
And sometimes they do the extended tummy tuck. And when they do weight loss, patients, because they did it the bariatric, they lost a lot of weight. They do the 360.
Yeah, all of our
That's one
almost
of the,
every tummy tuck we do is
that's one of the
360.
hardest surgeries I ever seen.
Yeah.
The 360 tummy tuck. Remember, they remove the skin and the
All
whole
the way
body.
around. Yeah, so
right?
we call it the belt because it's literally
That's the belt.
Yeah.
It's exactly like that.
Mhm.
So those things like that. So that's why we had to be careful with all this recovery.
Yeah.
That makes sense. In the beginning, you had the binder,
Yep.
you had your drains, it's fine. But then later on, it becomes super uncomfortable.
Yeah.
That's why it's better to put it the stage 1 Faja. We call it stage 1 light compression recovery Faja. Okay. So people ask me, what about the drains? You have no problem wearing the drains.
Yeah, no, it's pretty easy.
It's pretty easy.
Yeah.
You just get it a little hose right here and just hook it right there.
Yeah, we always tell patients to bring like a lanyard, like the thing you hang around your neck.
Yes.
Clip it to there.
Try to keep it a little lower because this is the thing. Okay, I noticed that many people do that.
Yeah.
And in my opinion, that's a mistake.
Yeah,
when
because
you bring the drains comes up. So remember, you need to drain it out. So keep it low, because I noticed some people, they had the little hose right here, and I say, no, try to keep it down and milk it. Like
that actually makes sense.
That makes sense?
Think about it, yeah.
Because, the idea is to get the fluid out.
Yeah.
And you know what? Once you are like the doctor, I always say to everybody, follow the recommendations from the doctor. I'm not a doctor. I'm just about the Faja.
Yep.
But I'm just going to give you a recommendation. I'm never going to tell you nothing about what to do about that.
Right.
People, they say, Natalia, have you seen this before? And I say, best thing that you can do is call your doctor right away.
Yes.
Even though that I know the answer, I never get involved in those things because that's very delicate.
Yeah, that is true.
It's very delicate. I've seen so many cases, and even only one time, it was a lady in my shop, and she had it was red. It was too red, and I say, no, this is not normal.
It's infected.
And I say, you know what you should do? You should call the doctor.
Yeah.
Call the nurse. And I say, the doctor is gone. I say, call the nurse. One of the nurses, because you need to see this ASAP. Right away, she was in the ER.
Yeah.
She has a super big infection.
Yeah.
So that's things like that. But you know what?
You can at least guide them to the right way.
Yes, I say, no, just like that. I say, listen, do not call your friend. Nobody. Call your doctor right away. One of the things that sometimes we make mistakes is waiting too long.
Yeah.
Don't wait. Listen to your body.
That's true.
I always say to my customer, listen to your body. Because your body's trying to tell you that you don't feel good. Your body's telling you that you are hot, that you got an infection, that you have fever, that you have all those things, Yeah. And this is the thing, Kayla. Infection, they can happen.
Of course. It's part of, unfortunately, with any surgery, but especially with plastic surgery, like complications happen. They just do.
Yes.
It happens.
That happens. Complications happen. That's what I say, just listen to your body.
Yeah.
And just because if they can take care of the infections right away, it's perfect.
Yes.
It's amazing. No, things happen. You know what? Every time that you're going through surgeries, even when you do a little something in your teeth.
Yeah. Anything. Yeah.
Anything.
And you can follow all the rules as well. Sometimes our bodies just don't want to communicate. They're like, where?
Sometimes
our bodies are just like that. But I think that's also why, like with EOC, we make the patients stay, a while after, just to make sure that, we get them on the antibiotics. Because I know a lot of plastic surgeons out here in, or locally or wherever you live, it's like an outpatient thing. You have the surgery and then you go home. So it's very important that you do stay a little while longer. So, your nurses, your surgeons, they can all keep an eye on that.
Yes.
Yeah, it's
one
very
of the
important.
things I was very impressed when I came from Colombia, because I did my surgery in Atlanta. That was in 2006. I did my breast implants the first time, and they sent me home the same day.
Same day, yeah.
I'm like, the same day? My sister came from Colombia and she helped me. And I say, this is so weird. What do you mean we go? Normally in South America, so you stay for about 1 or 2. It depends on the surgery.
Yes.
So, normally you stay, you're doing like a liposuction, mommy makeover, you stay at least 1 day just to see, because, the doctors, they will check on you, the nurses, they always checking on you. But I hear no.
No,
it's the same day. Go home.
It's crazy. Even with bariatric surgery, same thing. Like with us EOC, even the bariatric patients, they stay for 6 days, 5 nights.
6 days?
6 days, 5 nights. After you come in a day before, and then the next day is your surgery, and then you stay another 4. And it's.
What about when they do plastic surgeries?
It just depends on the surgery.
Exactly.
But anywhere between, I want to say, like at least a week or 12 days. But I'll tell you what we do. People say, can we stay a little bit longer? They actually come home with their stitches still, because they don't want them to stay to where their stitches get removed and then fly, because then they say, you've got more chance of an opening if you're flying right after your stitches get removed, which is around the 2-week mark. So they send them home right before that, and then about like 3-4 days, maybe like 4 or 5 days after, and they're always in touch with the surgeon, the coordinator, and they send pictures and they'll say, okay,
they remove the stitches here.
Yeah, they had we teach them, like we have a tutorial how to do it, and a lot of people do it. It's very easy. It's just like pull and snip, and they can remove their drain and their stitches by themselves here.
Oh,
so
wow.
we show them
so they don't have to go to the doctor?
Nope. Don't have to go to the doctor to do it.
That's amazing.
Yeah, and honestly, like a lot of the surgeries that we do, they're very minimal stitches now because they're all internal. So maybe just the belly button might need some stitches come out. For me, when I had my last round, which is thighs, I did come home with some stitches. But, I have a nurse friend that just came over and she's like, I'll take them out for you.
How was the recovery in the inner thighs? I see that one is a little challenging. I've seen so many complications with the inner thigh surgeries.
I will tell you, Natalia, I waited so long to do my thighs because I was so scared because I'm like, gosh, you always see openings, right?
Right, always. It's funny, I'm not trying to interrupt you, but majority of the time that I see openings is always in the inner thighs.
Can I tell you why? Because it's a high friction area, So my surgeon, he used to do the short scar and the extended thigh lift at the same time. So to meet it at the groin at that T intersection. So he said to me, Kayla, I'm not doing the inside. I'm going to do the extended first. And if you want to come back, we'll come back and do the other to lift up. So my first was like pulling in. Natalia, it was the easiest surgery I had. Really? My thighs was the easiest because I was very vigilant. There's a few things I would tell people for thigh lift surgeries. You have to keep it clean. You have to keep it dry at all times. That area, we're prone to just, it's a gross word, but moist. Like it gets moist in that crotch area. So I had the Faja with the opening there, had a fan, a little battery operated fan, make sure it was always dry. When you go to the restroom, my sister was my companion and she takes care of me. She's the best after every surgery. But, every time I'd go to the bathroom, because obviously bodily fluids, pee and all that stuff, you got to make sure it's always clean because it's right there. Like I noticed,
I'm sorry, you guys use something in Mexico. It's like a powder, like antibiotic powder. Do you use that?
We don't do any powders. No, we do powder. Like just a spray, like a Rifocina. There's like an orange spray and then the microdicin, a clear spray. So we do they teach you in Mexico, they'll teach you how to dress your wounds, how to, what you need to do. So it's really cool how UAC works. But I will tell you, so keep your crotch area always dry and clean. After each time I went to the bathroom, I would spray the antiseptic spray. I would pat it down and then fan dry it.
How often do you do it? The cleaning? Morning and night?
Well, I do shower once a day. But every time I went to the restroom, I would just clean that crotch area, that groin area.
Like you say.
Don't want anything just coming in that area. So, and then, spray it, fan dry it, and then just kind of let it air out.
And let me ask you a question now that you say that, because many customers, they ask me, when you had that type of, let's talk about only for the inner thighs. So, were you away from work for 1 week, 2 weeks? How long were you off?
Well,
because that is a serious surgery.
It's a serious surgery. For me, I work for UAC. This is my job.
Right.
So I didn't come into the podcast for, I want to say it was about 6 to 8 weeks. I couldn't really come in, but I worked from my phone. As soon as my eyes opened from recovery, I was posting. I think I was like still out of it and I was posting craziness. But, I went back to, phone work right away, but actual physical work, we recommend 8 weeks.
8 weeks.
8 weeks of recovery is super important no matter what.
8 weeks, you see, 8 weeks.
Because
so people, they had to remember this. They're not going to be producing money for 8 weeks.
Exactly. Yeah. And
that's 2 months.
It's a long time, yeah. But if you go back too soon, you're
gonna prolong the recovery.
Exactly.
That's gonna make it worse because then you have to start over.
So planning for plastic surgery, there is a lot of things to take into consideration. It is the time off. It is the recovery. You need, I think you really need someone there to help you, especially if you're doing something like thighs. But, if it's just a minor, I hate to say minor surgery because I don't think any surgery is minor, but if you're not a massive weight loss reconstructive patient, for us, we do big combos. We don't really just do one tummy tuck at a time. We do pretty much every day at EOC. We do the big 5.
But only one surgery a day.
One surgery a day, but we have 4 surgeons. But so the most popular combo we do is a 360 belt tummy tuck, lipo, muscle repair, BBL, and either breast lift with implants and the back lift, or they do the arms instead. So you're getting at least five. So it's a big combo. So it's a big recovery. Now, if you're just going for, say somewhere for lipo and BBL, I'm sure that recovery is a lot easy. A lot easier. Yeah. Not easy, probably. I don't think any recovery is easy, but a lot.
Any recovery is easy. Oh,
exactly. Or if you're just going for a breast implants, it's different. But for us, those big combos, we say
Kayla, let me
8
ask
weeks.
you a question. Do they do the inner thighs and the arms at the same time?
Yes. So usually what happens, massive weight loss patients, they will recommend stage 1 will always usually be the belt, the boobs, the back, the lipo, the BBL.
Okay.
And then round 2, they recommend arms and legs.
Oh, that's how it works.
That's how it works at UC. I did mine a little differently. Because when I never thought I would have all my body done. I was like, if I can just pick one thing, I want my arms. So I just went and did my arms first, and I didn't think anything of it. I didn't think I would ever do the rest. And then I got really fortunate to come work for UAC, and they're like, hey, come back and do your mummy makeovers. And then I did that. And then, I did the boobs and the butt and the belt and all that. And then it was just last year, so 3 years after all that, they're like, are you going to finish? Are you going to do your legs? And I'm like, oh my gosh, I see so many openings. I see so many complications. I really don't want to do I want to do them, but I don't, And then last year I bit the bullet and I did my legs, but I also got my breasts redone at the same time because mine bottomed out. So I got another breast lift revision, and I changed my implants out to instead of, we do the Motiva. So I had the Motiva, but I ended up going with the polyurethane ones. So they kind of stay in place a little bit. Mm-hmm.
So let me ask you a question. When you guys do the arms and the inner thighs, how long it will take for the surgery?
The surgery time?
Surgery, yes. About 4 hours?
Yeah, I want to say it's about 4 hours usually. Yeah. And it just depends if they do. Usually everyone needs the extended. So from the elbow all the way up and down to the side, because it takes care of the side boob too.
Oh, they do that too, right here in this area.
Yeah.
Right?
So sometimes you just do up to here, and then most of the times it's because you get that side boob. So it takes care of all of that. And you know what's really cool? After a lot of people, after an arm lift, that removes the sweat glands and the hair follicles, so you don't have to shave under your arms.
No way.
I haven't shaved under my arms in a long time. I think I grow one hair here now because it just it moved back. But yeah, you can see. Yeah, I've not shaved under my arms in years.
Wow.
Isn't that cool?
It's not amazing?
It's so cool. I'm like, oh, that was an added extra bonus I wasn't, ready for, but I'm glad it happened.
Let me ask you a question, because people ask me that question. So the age, what is the age limit for doing kind of surgery like that?
For EOC, our age limit is 65.
65.
Mm-hmm. Yeah, 65. Because it is an elective surgery, you know what I mean? So every surgeon's going to have their own requirements, but a lot of our patients are massive weight loss patients. So again, there's a lot more that's working against us being a massive weight loss patient, right? So 65, and then the BMI, 31 or below.
Okay.
Yeah. So there are a lot of people who are like, can you, recommend a place that does plus size tummy tucks? Well, each surgeon's going to be different.
So what do you say? Every surgeon?
Every surgeon's different. Our BMI limit, I think the standard is supposed to be 30, but I think we went up that one extra point to allow for the extra skin, because the extra skin, it can weigh a little bit. But I think the crazy thing is people say, I've got all this extra skin, but I think you'll be surprised how much the skin actually doesn't weigh. If it is just skin, it really doesn't weigh that much. I lost 200 pounds, right? I thought my skin was going to weigh so much. My skin, because I had no fat left in that skin on my tummy, my skin only weighed 2 pounds.
All the skin, it was only 2 pounds?
2 pounds. Because I didn't have any fat in my skin. It was it was all wrinkly. Right. It was all wrinkly, but sometimes people still have quite a bit of fat. You can still see it's a lot of skin, but you can still see that there is some fat in that skin, and that's when it weighs a lot more too. So
that's amazing.
Yeah, you can see
So when
difference.
you did for you, for the skin removal, how many times have you done that before? It's only one time?
3. So I did 3. So I did my arms, and then my mummy makeover, and then I just did my legs and I did some tweaks. So I did a tweak on my back of my belt and then a tweak on my boobs.
Exactly.
Yeah.
It takes a couple of revisions.
And I'm not finished either. I'm not finished.
What is next?
Well, it just depends. It depends on if I want to keep going, because I hate the recovery process. I hate being down and out for 8 weeks. I hate it, Natalia. It's the worst. But
You're very active.
oh,
You like me?
I am. I got to do something, you know. And I'm like, oh man, everyone's like going out having fun, and I'm just like laying here. So it just depends. I knew going in to do my legs that I needed several rounds on my legs. So again, the first one was to pull in. The next one will need to be to pull up. So you know,
a little lift.
Yeah, but I'm like, do I want to? But and I want a nice booty. So I also
pretty
want
young.
to do.
How old are you?
I'm not that young.
You're in the 40s?
Yeah, I'm 41.
But you're pretty young. Yeah. Still recovered is pretty good for you.
Yeah, I mean it's.
But you look. I mean, honestly, for me, your body, you look very proportional. You look. Your shape. You look very healthy.
Yeah, thank you.
You look very good.
I think that's the.
Good. And take your time, enjoy it.
That's the thing. It's like just. Everyone's journey is going to be different. Some people chase perfection, and I think I'm at the point where I realize I'm not going to be perfect. I didn't start at a baseline. I had all these surgeries just to get to a baseline, and my body isn't even normal yet. And I'm like, what is normal? And who cares? Who cares?
Well, what happened when you chase perfection? You chase obsession.
Exactly.
You become obsessed with all these things, and then something else. You go with your face, or you go with your lips, or you go with something. You're always going to find something.
Always.
No, I love plastic surgeries, but not to get it too over the top.
Yeah, you got to know where that line is. And I think working in the industry, because, you're connected with a lot of surgeons, and, I see it every day. And all these surgeons, I love them. They're my friends, they're my coworkers, they're my bosses. Working within the industry, it's so much more accessible. Yes. You can just do it, and it just becomes normal. It's like, well, why aren't you doing that? Of course you're going to do that. And then you got to sometimes slow down and think, well, just because it's accessible to me, do I need it? Do I want it? How's it going to change my life? So that's the thing. For me, I'm at the point where I'm like, I'm happy with where my body is. I could keep going. There's days where I'm like, well, now I want to get everything else done. I want to get my ribs done. I want to get the big butt. I want to look like Jessica Rabbit. But then I'm like, okay, but Jessica Rabbit was never 350 pounds, So at what point do I just go like,
so you got the point, So this is one of the things, and I'm glad that you guys do it, because you know what? Not many people that had the opportunity to have a plastic surgery. Okay, so sometimes plastic surgeries is not like a luxury. They had to have the plastic surgery. Like I see many of my customers, they have so much skin, loose skin, and that becomes annoying.
Yeah, and
why? Because infected
as well. Yes,
sometimes I got customers coming to my place and they smell. They smell because they had to leave the skin like this, and this area right here started smelling. I'm like, wow. Yeah. So and the rubbing on the skin, gets irritation, rashes, infections, all those things. They really need to get the surgery. Not only that, last week I got this pretty girl. She was size double H.
Her back must hurt.
They were the biggest boobies I've ever seen in my life.
Really?
I felt so bad because she was only 24.
Oh my God.
24 years old, she was a baby. And I say to her, you know what, honey? You can apply through the insurance. I don't know how. So I'm trying to help her, to find out how she can go. Because if she goes to the primary care doctor, and show by fact that that's affecting her health. She's like, Natalia, all the time, my pain is so bad right here. Natalia, I cannot even breathe. Sometimes I cannot breathe. Sometimes I pull and I say, I cannot even find bra. No. It was so sad. Those things, how she was trying to find a bra and I said, I didn't even have the bra.
Really?
And even cannot make a special bra for her.
Yeah.
Because the bra that I had, they are for plastic surgeries. You won't get the support. Yeah. She needs something, not even Victoria's Secret.
Yeah.
She wears sport bras. I say, Natalia, it's so hard. So things like that, they really need, she needs help.
Yeah, exactly. And that's what we specialize in, is like reconstruction.
That's great.
It's not just like the cosmetic side of it. It is definitely the reconstruction
But not
side.
only that, the prices.
Oh,
so the people, they can afford, because here people ask me, couple of things. Natalia, why you do all the surgeries in Colombia? Couple of reasons. One, because my whole family lives in Colombia. So I have somebody to take care of me there.
And it's home.
And it's home.
Yeah.
And honestly, it's cheaper for me.
Yeah. It's a lot cheaper.
It's cheaper for me because that surgery was a little complication right here in my breast. Here it can be something because I have complications around $22,000 to $25,000. In Colombia, I pay $10,000. I don't recommend that. I'm not saying go to Tijuana, go to Colombia. I'm not saying that. Because sometimes people, they take it. I'm just saying, for me, it was a lot of money.
Yeah.
When I did my surgery, that was about 9 years ago. So and I say, Chloe's gonna be, I was 8 years ago after I had babies. So that's the thing. So, but it's easier sometimes, because it's expensive.
Yeah, it is.
And you guys have the plans,
Oh, yeah, yeah. So for us, because of all we do the combos, we do a combo package. So it's for pretty much, say you get a tummy tuck here, you could probably come to us and get the whole thing done. The whole tummy, boobs, back, butt, the same price as you're going to get a tummy tuck. But the results are incredible because the thing with our surgeons, they specialize in massive weight loss reconstruction. They're not just a regular plastic surgeon who does just tummy tucks. They actually specialize in contouring the body.
They already know those kind of bodies.
Yes. And I know that you have some local Vegas girls that have been to EOC that have come to you for their Fajas. You know Janelle?
Yes.
So she came to Dr. Lazar's, who's my surgeon as well. Yeah.
Amazing.
Yes. So he's like, they're all absolutely incredible. But I do want you to meet him.
The aftercare is amazing that you guys do in Mexico. Is unbelievable.
Yeah, and it's a shame.
You guys offered everything,
everything.
The home recovery, everything, and the massages.
Yeah, the recovery.
So everything is inclusive.
Yeah, all inclusive packages. It's incredible. It is amazing. It's so safe.
I used asking the question because everybody asked me the same question in Colombia. Is that safe?
Yes,
it's safe.
Yeah, we're in a 5-star hotel and casino, and in that casino, in that hotel, we have 3 medical floors. And our offices in that casino, we have drivers that take you to and from all the appointments. It's incredible.
So how does it work? So they pick you up there at the border?
San Diego Airport.
San Diego.
You fly to San Diego Airport, driver will pick you up, take you over the border, take you to the hotel, you check in, our staff check you into the room, and then the drivers take you to your pre-op appointments, get all your blood work done.
So they come all the way to Mexico, to San Diego to pick you up?
Yeah.
I thought they pick you up right there in Tijuana.
No, they pick you up at San Diego Airport.
Amazing. They give you security.
Oh my gosh, it's incredible. You don't need to take an international flight. You don't even need a passport. If you're an American citizen, all you need is your...
you don't need passport?
We need our green cards, but you need if you're a citizen, you just need a valid ID and your birth certificate. Just when you're coming back into America, because you drive straight through. It's a border town. You just drive straight through into Mexico. You really don't stop.
It's amazing.
It's incredible. And it's such a well-oiled machine. So we do that with the weight loss patients, with the plastics patients. People come for dental as well. And now we just put on we have a facelift. So we do facelifts, and we just put on a vaginal rejuvenation.
How is that working? Because many people, they ask me for that.
Good. It is good. He's incredible. I actually interviewed one patient for the podcast. She's done every surgery with us, from weight loss to every single surgery, facelift, body, and now she did that. She said he's amazing because he's also like he's gynecologist as well. So he does like incontinence, all the tightenings, the cosmetic side of things. Like, he's so knowledgeable.
That's amazing.
Yeah.
Okay, let me ask you a question. How does it work? Somebody wants to make an appointment. Do you guys do like a FaceTime call, or they had to go there for the first time?
No, they don't have to come, but it's not a FaceTime. It's a, they fill out the health application. So they fill out all the details, and then they send the pictures. So we tell them what pictures, front, side, back,
Same.
Surgeon reviews it, gives them this is what they need, Then they go through their coordinator. Coordinator tells you this is the price, this is what it includes. When do you want to book? And Natalia, we're booked out.
I believe it.
Yeah, this whole year we're booked out. So people are on wait list to get in, to get cancellations.
Wow.
Yeah, all 4 surgeons, they're booked out, until next year already. So yeah, it's very popular but their work is incredible. You know what I mean? It's not just the price, it's the service, it's the results.
I'm not surprised because you know what, the work that they do in South America, I seen amazing surgery. Believe it or not, I got a surgery. One of my plastic surgeries, it was in Tijuana.
Oh yeah, nice. How long ago?
So my ex-husband and I, we used to go. Okay, his parents, they used to live in San Diego. So and he used to go to do all the dental in Tijuana. Yeah. Right. So and one day I was there and waiting for him at the hospital. Oh, it was taking so long. And I started walking all the floors just to see what's going on. So, and I saw a plastic surgeon. It is Natalia. And I go to the doctor and I say, can I do a consultation? I say, yeah, when? I say, now. And the lady look at me and say, what? Yes, now I want to do a consultation now. I say, okay. She give me the consultation.
Nice.
So I saw the surgeon and I say, hey, listen, I just hate this little because I used to have a deep line here on the sides. That's very genetics. My whole family had it. So, and I say, what can I do? And I say, well, let me explain it to you. We can do like a mini flank lipo right here and take the fat out, process, And I look at it and I say, okay, so when can you do it? And I say, again, well, he said, no, what do you need from me? I say, well, it's a process.
Yeah.
Okay, what is the process? I say, we need to do the blood work. I say, okay, do it now. I say, girl, you crazy. And I say, no.
No, I'm Colombian.
I'm Colombia. Then I say to my ex-husband, I say, Robert, how long are we going to stay here? And I say, well, I think we're going to stay for another 2 days. And I say, perfect, good.
I got time.
What are you doing? And I say, no, in the morning I had to do the blood work because I'm going to do like a mini surgery. One of the best, most amazing things ever done in my life.
Fat transfer.
They did the fat transfer. Beautiful. That was the only thing that worked on my body.
Oh,
I used to do a lot of wrestling, the fillers, these things, nothing worked. Nothing.
Nice.
Until the guy did it and it feels right here. Oh my God, it used to be deep. He filler.
Yeah,
and I like,
look at you.
I kind of like it. I like to look natural because, one of the things I don't mess with my face.
Yeah, right.
No, I don't. I just like a little bit.
It's tricky.
It's very tricky.
You can't hide your face.
No.
If it goes wrong, you can't hide that.
No.
Yeah, we can hide it. Everything else, we can't hide your face.
We can hide this, but with the face, no. But I was very pleased with the results. So my point to you, don't be scared. Yeah. I mean, honestly, people, they are like, oh my God, I can imagine going to Tijuana. I say, no, don't say that.
Can I tell you what I love about Mexicans as well? And when I'm in Mexico, they are so accommodating.
They do.
Whatever you want, they're going to do it for you. You want it now? Nothing. There's never a no. They'll figure out a way to make it work. It's such a good culture.
And another thing really quick, the language. That's a problem for the customers?
No, all of our staff speak
Everybody's
English.
bilingual?
Everyone's bilingual.
Amazing.
Yeah, it's so cool. It's so close. We're 20 minutes from the airport. We're 20 minutes from America.
No, I mean, I love it.
Yeah, it's up and coming. I think there's just such a stigma about Mexico. But I think as time goes on, everyone's starting to realize it's the place to be. Okay, so one last question before I let you go. Can you just educate us really quickly on Fajas and the boards and the foams? Like, why do we need foams? When do we need them? Can you break that down for us real quick?
So Fajas word is so important because remember this, it's going to help you to get the swelling down, the compression, the right compression.
Yep.
When do we start wearing the lipofoam? We call lipofoam. So right after the surgery, because that's very important. It's going to help you with the liposuction, to help, believe it or not, that compression right there in that area is going to help the swelling to get down.
Yep.
But not only that, because I got so many doctors, they say, no, but she didn't have a liposuction. Why she's wearing a lipofoam? Because also the lipofoam, it covers the incision.
Yes.
So that protects, for protection, help the swelling and the inflammation down. That's the lipofoam for only 2 weeks.
Okay.
I know in many cases, they keep wearing the lipofoam for longer than that, and that irritates the skin.
Okay.
So remember, that's why stage 1, we call recovery stage 1 with the lipofoam, no more than that. Then you switch to the stage 2. Once they remove the drains, we're going to move to the stage 2.
Okay.
No more lipofoam, and we go with the abdominal board. It's a board. It's hard. Inside is foam, and outside is board. What is that? Because with the compression that it has, it's going to help the fluids. Remember, all the lymphatic area is right here in this area.
Yes.
It will push it out between the massages. I love the stage 2.
Yeah.
Why? Because
stage.
it's magical stage.
Yes.
Thank you. Yes. Because
agree.
you know why? In the beginning, everything is frustrated because you look big, you look. So wait, I look the same.
Yeah.
Yes, you look the same, pretty much the same. But at the stage 2, it's funny because sometimes I got customers, the stage 2, oh my God, it feels super tight. Say, you're supposed to be, compression, support, not super tight that you can't even breathe. No. Don't get surprised. 3 days later, the faja is big.
Yeah, right.
And I said, wait a minute, what's wrong with the faja? It's nothing wrong with the faja. Right away, the faja, what it did, it pushed out all the fluid. Because that's when we start with the stage 2, what is inflammation between the faja, the lymphatic massages, and the board, abdominal board or the back board.
Yes.
So we help together, to get that inflammation.
Yes.
So the 3rd week is when you start seeing the results.
Yes.
That's when you are happy. Okay? Then we go for another 4 weeks with the stage 2. My fajas, they have 4 notches. So you move to the next notch once a week. Always after the massage. Because remember, the person doing the massages, you need to keep it tight. That way, you have the support. Then we go to the stage 3. What is the stage 3? That's a high compression. It's tight. That's tight. But then your body by then is healed.
Yep.
So that means you don't have any opening. What I say to my customer, for example, Kyla, do you have any opening? No opening. Completely close everything. Perfect. Now we can move to the stage 3.
Love that.
And then the person is saying, wait a minute, Natalia, I was in a size extra large and now you're going to get me back to the same size or even higher. Remember this. Every time that we move to the next stage, it's tighter.
It's tighter.
Means that it's going to increase less stretch. It's going to increase the compression. That's the thing.
Yes.
But then we keep wearing the abdominal board. Okay? Then, remember, this is the thing with the fajas. The beginning, 24/7 for 3 months. Because I notice many doctors, they say in 6, no, wear that for 4 weeks and you're fine. You don't need to wear that anymore. One of the things, Kayla, I see with all my customers, inflammation, it takes about 3 to 6 months.
Oh, yeah.
It's very frustrating.
Yeah.
And it's one of the things that you cry and I say, what's going on with my body? But remember, sometimes it's the time of the month that you get inflammation. Plus that, not only that, it depends what you've been eating, a lot of sodium.
Yes.
It creates a lot of inflammation.
Yes.
And not only that, when you start feeling good, what do? You start moving around and you feel like you are okay. That causes inflammation.
Yep.
So you have to deal with the inflammation.
By the end of the night, if you've been without your faja for the whole day, the end of the day, you're like, swell hell. And then put it back on.
Put it back on. Then one of the things, when are you going to start honestly seeing the results? 6 months to a year.
Yep.
It takes that. I mean, honestly, it takes for all the surgeries that you do. But, that's why fajas are very important. Lymphatic massages. It's like a combo. Fajas and massages, they work together. That's why, like you say in the beginning, do the research before your surgery.
Yep.
Once you have the person set it up for you, do it. The other thing that I say really quick, when it's not that easy to find somebody to do the lymphatic massages.
It's tricky.
It's one of the most difficult things.
Yes.
But guess what? There is another thing they call hyperbaric chamber machine.
Oh, yeah, we do that too in TJ.
You guys did it?
Okay,
let me ask you a question. When do you guys start doing that after the surgery?
I did, for my thighs, I did the hyperbaric. It's not compulsory, but it is advised if you can. Because they're a little bit pricey too, but I did mine, I want to say like the second, third day after. And I think I did 5 sessions. So you can start doing
that like that?
I did mine 5 sessions.
Okay. Because people ask me, how soon can I do that? And I say, no, it depends on the surgery.
Yeah.
Ask the doctor, because I noticed it was a lady, she was doing everything. She was doing the faja, the massages, the hyperbaric chamber machine. Her body was like unbelievable in 3 weeks. I was like, what do you do?
But the hyperbaric chamber, even if you haven't had surgery, like it's so good for you. And like you can see it. I could see it in my face immediately. It was like my face is glowing. It looks like I just had a full face of Botox or something. Like it's
because you see the glow.
Yeah, it's so good. It's good for you. But
how long is the it's about 45 minutes to 1 hour, right?
45 minutes to an hour, because it takes you a while to like get to the we say like it's almost like you're in a submarine and it doesn't move, but like it pressurizes. So it's like you're like submerging it. So I think it takes like 15 or 20 minutes to get to the pressurized, and then it takes another 15 minutes to like.
And the reason I say that is because you know what? I got a customer that she get a big opening because she was a smoker. She has a necrosis.
Yes.
Well, one of the worst things. The only thing it really helped to close the wound, it was the hyperbaric chamber.
Because it's
she got the wound back.
Oxygen.
For weeks and it didn't work. Then she did the hyperbaric chamber.
It's the purest form of oxygen that you can have. It does heal the body.
Amazing.
Yeah, it does.
It can get pricey, it's true, but you know why? It's another choice, guys, that you can do it too.
Well, also it's better. It's good for like a bunch of things. So I have a coworker who had a bunch of like cysts and stuff happening with her bladder, and here in America they said the only real thing that can help you is a hyperbaric chamber, and I think it was going to be like the real chamber was going to be like $1,000 a session. She went to TJ, and in the hotel that we're at, there's a chamber there, and it's like $110 a session. So she stayed out there for 2 weeks and did a session every day, and it helped her so much. Like it almost reversed her problems. The only thing that she tried everything, she did surgery, she did everything. But so it is quite a miracle. I feel like we need more out here in the USA. But okay. So we're gonna wrap it up. But Natalia, can you just tell people where, if they're like want Faja help or any questions, where can people find you?
Yes, absolutely. You can contact me through Instagram. Faja Sweat. We are right there. Also, you can send a text message. You can go through the website, give us a call. Everything that you guys need, I'm right here to help everybody.
All right. So
we do, and the consultation, they are free.
Oh, beautiful. So we'll write it down here. So Faja Sweat, we'll add all your info here. So
the Faja Sweat, the phone number.
Yeah.
The website and everything. And you know what? The prices of the Faja is $130.
Oh, okay.
Because And the prices for the board is $30. You know, that way people they know.
And is that for every stage?
Every stage.
Oh,
yes, it's about, you're going to go for about 2 to 3 fajas.
Okay.
Through all the process.
I love that.
Yeah, you having me.
No, thank you for coming on and educating us. And if you guys are having plastic surgery, do your research, do your aftercare research before you even have the surgery. And Natalia will hook you up. She's
no, you just have to do it right, because after you're spending thousands of dollars, you know, you don't want to go and buy any kind of faja, because you can ruin your surgery.
Yep, very true.
That's the truth.
Yep, very true. Well, thank you, Natalia.
Thank you, Gail. I appreciate it.
Bye, and we'll see you guys next week on Bariatrics and Beyond.